Welcome to the Hubbell, Roth and Clark's benefit enrollment for the 2023 plan year. The benefits you hear about today and the elections you make during this enrollment period will be effective January 1st. If you are a new hire, your benefits will be effective on the first day of the month following or coinciding with 30 days of employment. Open enrollment happens once a year, and it is your opportunity to learn more about your benefits, make changes to your benefit elections, add or remove dependents, and enroll in new coverages. Hubbell, Roth and Clark is proud to provide employees with an extensive list of benefit options. Our benefits are available to full-time employees and their dependents. We offer 3 medical plans with Blue Cross Blue Shield of Michigan, 2 PPO plans, and 1 high-deductible health plan that allows employees to establish a health savings account administered by Health Equity. Our pharmacy benefits are administered by OptumRx. Our Blue Cross Blue Shield medical plans include a diabetes and hypertension management well-being benefit called Livongo that helps employees build healthier lifestyle habits and includes a personal health coach. Hubbell, Roth and Clark pays a significant portion of the health insurance premium for you. The dental coverage is offered through Delta Dental. Our life and disability insurance coverages are with Hartford. We offer vision, accident, and critical illness plans with Guardian. Our flexible spending accounts are also going to be administered by Health Equity. We provide a comprehensive employee assistance program at no cost to you through Metropolitan Family Services. Over the next few minutes, we will review these coverages in more detail. All of the information provided today is available in greater detail in our benefits guide. Contact information for all of our insurance carriers and benefits consultants is also included in the guide. Be sure to review this guide before making your elections. You will enroll for your benefits using our BenExpress online enrollment system. Log in with your username and password using the format shown here. BenExpress will guide you through all of the benefit plans for you to make your elections. When you are finished, save or print a copy of your confirmation statement for your records. If you elect a coverage that requires evidence of insurability or additional forms to be completed, you will be prompted to print the forms at the end of the enrollment process. Beneficiary forms must be returned to the business office. Our health plans cover in-network preventive care services at 100%. There is no cost to you for annual physical exams, well-woman, well-man, and well-child exams, including preventive lab work. Preventive mammograms, prostate exams, and colonoscopies are covered after you reach a certain age threshold. Generic contraceptives are also covered at 100%. And finally, don't forget that annual flu shots are considered preventive care and covered at 100%. We encourage all employees to take advantage of our preventive care coverage and seek routine checkups. Our Simply Blue HSA plan is also referred to as the base plan. Blue Cross Blue Shield pays 100% for preventive medications, such as treatment for high blood pressure or high cholesterol when provided by in-network pharmacies, up to an annual benefit maximum of $500. These medications are not subject to the deductible or copays until the benefit maximum is reached. All non-preventive medical services and prescriptions are subject to a calendar year deductible of $1,500 for single coverage and $3,000 for two-person or family coverage. Please keep in mind that the deductible for two-person and family coverage is non-embedded, meaning the entire family deductible must be met before copays and 100% coinsurance for medical services will begin. Combined with your annual deductible and prescription drug copays, the out-of-pocket maximum is $2,250 for single coverage and a $4,500 maximum for two-person or family coverage. After you've met the out-of-pocket maximum, Blue Cross Blue Shield will pay 100% of eligible in-network medical services and prescriptions for the remainder of the calendar year. The HSA plan also includes out-of-network benefits. However, out-of-network services will be subject to a separate and higher deductible and out-of-pocket maximum. The Simply Blue PPO copay plans offer copays for physician office visits, urgent care centers, emergency room visits, and prescription drugs. All other medical services, such as major diagnostic testing, inpatient hospital stays, and outpatient surgery, are subject to a calendar year deductible of $500 for single coverage and $1,000 if dependents are covered in the Simply Blue Mid Plan. The deductible for these services in the Simply Blue High Plan is $250 for single coverage and $500 if dependents are covered. After you meet the deductible, Blue Cross will pay 80% of covered in-network services that are not subject to copays, and you will pay 20% until you meet the out-of-pocket maximum. For both plans, the total out-of-pocket maximum includes the deductible, coinsurance, and all copays. After you meet your out-of-pocket maximum, Blue Cross Blue Shield will pay 100% of eligible in-network medical services for the remainder of the calendar year. All medical plans offer additional lifestyle benefit programs at no cost to eligible employees and their adult family members who are enrolled in the Blue Cross Blue Shield of Michigan Health Plan. The Livongo Diabetes and Hypertension Program provides eligible participants with an advanced blood glucose meter, unlimited test strips, personalized meal plans, weight management assistance, and 24/7 expert support through a personal coach. Livongo is available to employees and their covered dependents that are pre-diabetic or have been diagnosed with diabetes or hypertension, who are also enrolled in the Blue Cross Blue Shield Health Plan. You can sign up as of February 1st by calling Blue Cross Blue Shield at 1-800-945-4355 or online at their website shown here. The Blue Cross Blue Shield of Michigan health plans offer convenient and affordable telemedicine care 24 hours a day, 7 days a week for non-emergent conditions such as cold and flu, ear infections, backaches, migraine, and more. Download the app or go online. Add your Blue Cross Blue Shield healthcare plan information to make sure you are charged the appropriate amount. Use the service key BCBSM and choose an available doctor to discuss your symptoms and concerns with. At the end of the visit, you will get a full report to share with your primary care doctor. Family members on your medical plan can also use the telemedicine service. Just add children under age 18 to your account. Your spouse and children age 18 and over should create their own account. The prescription program includes 2 cost management programs, step therapy and prior authorization. These programs are designed to help you manage your prescription drug costs. Step therapy is an automated process that provides coverage for one or more affordable drugs before covering other more expensive medications. This ensures all clinically sound and cost-effective treatment options are tried before more expensive drugs are prescribed. Prior authorization means that a review of certain drugs is needed before your plan will cover them. This ensures patient safety, lower cost, and high-quality care. If your doctor does not get prior authorization when required, your drug may not be covered. You have several resources available to you when filling a prescription. Mail order prescription service is available for a 90-day supply of maintenance medications, and this setup can save you money and time, as the medications are delivered right to your door. GoodRx compares prices for your prescriptions at pharmacies near you and will show you prices, coupons, discounts, and saving tips for your prescriptions. Also, remember, many pharmacies offer discount prescriptions that are often even lower than your copay. Keep in mind, if you use the coupons or pricing from these apps, it may not run through insurance or apply towards your deductible. However, it may cost less in some cases. If you enroll in the base plan, you may open and contribute tax-free dollars to a health savings account. A health savings account is your personal bank account that may be used to pay for medical, dental, or vision expenses for you or your dependents with tax-free money. You may also purchase over-the-counter medical supplies and medications with HSA funds. Please take note of the maximum amount that may be deposited to your health savings account each calendar year. Keep all receipts for payments made from your HSA, as this is an IRS auditable account. Using your HSA to pay for ineligible expenses can result in a tax penalty. If you are over age 65 and covered by Medicare, TRICARE, or covered under another medical plan that is not an HSA qualified plan, including a flexible spending account through your employer or your spouse's employer, you are not eligible to contribute to a health savings account. Blue Cross Blue Shield of Michigan works with Health Equity to administer the health savings accounts. With Health Equity, you will experience eligibility and claims integration with Blue Cross Blue Shield. If you enroll in the HSA medical plan and also elect to contribute money to a health savings account, you will receive a welcome packet and debit card from Health Equity. Utilize the Health Equity mobile app to manage your account. The Blue Cross Blue Shield website allows you to access your claims and copies of explanation of benefits. You can also find a network doctor or hospital, compare treatment costs, and more. Blue Cross Blue Shield also provides a mobile app. With the mobile app, you can conveniently access your virtual ID card, review your benefit and claim information, find providers, and more. We offer voluntary accident and critical illness plans through Guardian. Our accident plan pays benefits directly to you and helps you pay for expenses associated with an accident, such as emergency room costs, deductible or coinsurance charges, or lost wages if you are unable to work due to an injury. Listed here are just a few of the benefits our accident plan provides. You can cover yourself and your dependents. This coverage is guarantee issue. There are no medical questions to answer. Our critical illness plan covers conditions such as heart attack, cancer, stroke, and kidney failure, just to name a few. This benefit is paid directly to you if you or a covered family member are diagnosed with one of the covered illnesses. Benefit payments can be used to help with a variety of expenses associated with the critical illness, such as travel, lost wages, or insurance costs. This plan also offers enrolled employees a $50 health screening benefit, which pays you for receiving a preventive screening. If you are newly eligible for benefits, or if you previously waived coverage and would like to enroll during open enrollment, you may elect this coverage without having to complete a medical questionnaire. Coverage is guarantee issue. There is a pre-existing limitation on this coverage. Our dental insurance is with Delta Dental. You may receive services from in-network or out-of-network dentists. When you use network dentists, you will receive the highest level of benefit and save on out-of-pocket costs. Charges from out-of-network providers are higher than the negotiated fees charged by network dentists, and non-network dentists may balance bill you for the amount not paid by insurance. For this reason, we encourage you to use network providers as much as possible. The plan covers preventive services at 100%, basic services such as fillings, crowns, and simple oral surgery at 80%, and major services such as bridges and dentures at 50%. As long as you utilize a provider in the PPO or Premier network, there is no balance billing by the dentist after Delta Dental has paid their portion of billed services. If you utilize an out-of-network dentist, they can balance bill you the difference after Delta Dental pays their portion, which can result in high out-of-pocket costs to you. We encourage you to use network providers when possible. The calendar year deductible is $50 per person to a family maximum of $150. The annual maximum benefit amount is $1,500 per covered person per calendar year. During open enrollment, you can enroll now with no waiting periods. Our dental plan includes a maximum carryover benefit with Delta Dental. Under this arrangement, if you go to the dentist at least once during the year and your claims do not exceed $700, Delta Dental will add $350 to your annual maximum benefit for the next calendar year if you see a Premier Network dentist, and $500 if you see a Delta PPO Network dentist. You may continue to roll over benefits until an additional $1,250 is added to your annual benefit maximum. All covered members in your family are eligible for the rollover benefit. Our vision plan is with Guardian and uses the VSP network of providers. If you use a network eye doctor, you pay a $10 copay for a vision exam once every calendar year. Most lenses are available for a $10 copay, and you can purchase frames and be reimbursed up to $130 plus additional discounts off the balance at certain locations once every calendar year. If you choose contact lenses in lieu of glasses, the plan will cover the cost up to $130. If you use a non-network provider, you pay at time of service and submit the claim to Guardian so you can be reimbursed for your services up to a scheduled amount. Hubbell, Roth and Clark provides all benefit-eligible employees with long-term disability insurance with Hartford at no cost to you. This coverage protects your income in the event an accident or illness prevents you from working. The long-term disability insurance pays a monthly benefit of 60% of your income up to $6,000 per month. The controller, senior associates, and associates will receive a monthly benefit of up to $10,000 per month. Benefit payments begin on the 91st day of disability. You may continue to receive benefits for as long as you remain disabled or until you reach Social Security retirement age. Please note that the benefit is limited to 24 months for certain conditions. There is a pre-existing limitation on this coverage. Benefits will not be payable for any condition that exists within 3 months prior to your coverage effective date, until you've been covered under the plan for 12 months. Hubbell, Roth and Clark also covers the cost for you to have group life and accidental death and dismemberment insurance. The amount of life insurance you are entitled to is based on your current job title. You can purchase spouse and/or dependent children group life insurance at a minimum cost with no medical questions asked. Your life insurance coverage amount will show in the BenExpress enrollment system when you enroll. Make sure you review and update your beneficiary information. You may purchase additional voluntary life insurance through Hartford on yourself in $10,000 increments to a maximum of $500,000. On your spouse, you may elect $5,000 increments, not to exceed 50% of the amount you elect on yourself, or $250,000, whichever is less. Additionally, you may purchase $10,000 of coverage for your children. If you are a new hire and newly eligible for this coverage, you have a valuable guarantee issue opportunity to purchase new voluntary life insurance up to the guarantee issue amounts with no medical questions asked. Any election over the guarantee issue amount will be subject to evidence of insurability and approval by Hartford. The cost for this coverage will be calculated for you when you enroll in BenExpress. If you are currently enrolled in this coverage, you can keep your same coverage amount in place, reduce or cancel this benefit during open enrollment. You have access to Hartford's value-added services at no cost, such as travel assistance and identity theft protection. For more information, please see your benefits guide. You have the option to enroll in 2 flexible spending accounts with health equity, a medical care account and a dependent care account. The medical care account allows you to make pre-tax payroll deductions and use these funds to pay for medical, dental, and vision expenses not covered by insurance, or over-the-counter medications and supplies. The advantage of this plan is the ability to spend your money on eligible expenses on a tax-free basis. Your annual contribution will be deducted in equal amounts throughout the year, yet you will have access to your entire election immediately on January 1st or on your benefits effective date if you are a new hire. Once you make your annual election, you cannot change it until next open enrollment unless you have a change in family status. The funds you set aside must be spent during the plan year. Any balance remaining at the end of the calendar year will be forfeited. Your annual contribution into your medical care account cannot exceed $3,050. If you contribute to a house savings account, you cannot also contribute to a medical care flexible spending account. You may, however, contribute to a limited purpose FSA, which allows you to pay for qualified dental and vision expenses with the FSA, allowing you to use your HSA for medical expenses. This rule only applies to the medical care account. It does not apply to the dependent care account if elected. The Dependent Care FSA allows you to set aside funds to cover daycare expenses for children or for a disabled dependent of any age so that you can work. Funds will be deducted from your paycheck on a pre-tax basis. Funds in the Dependent Care FSA can only be used as they are deposited. We encourage you to review your personal tax situation, as you cannot use both the Dependent Care FSA and the Dependent Care Child Tax Credit when filing your personal income taxes. Please take note of the annual maximum amount you can contribute to your Dependent Care FSA. Please see your benefits guide for more details. Our Employee Assistance Program is offered through Metropolitan Family Services. This benefit is provided at no cost to you and your family members. Our EAP is a confidential resource designed to provide support in many areas of your everyday life. From emotional issues to financial concerns or legal advice, our EAP provides support from local experts, including licensed clinicians. You and your family members have access to 5 face-to-face counseling sessions per problem per year, provided by the EAP at no cost. We encourage you to use the EAP anytime you need assistance. Contact information for this service is provided in your benefits guide. We are proud to present this benefits package to our employees. Now it is time for you to take action. Be sure to review the benefits guide. Complete your benefits enrollment online in BenExpress by the deadline given, even if you are waiving all coverages. Utilize in-network providers for our health, dental, and vision insurance plans to maximize your benefits. For more details about each of our benefit plans, please refer to the benefits guide or certificate of coverage posted in BenExpress. Let us know if you have any questions, and thank you for your time.